Child care centers in Indiana might soon be unable to make ends meet. Thanks for joining us tonight. I'm Gina Galeros.
And I'm Derek Dennis. Thanks for watching. They tell us that's because of cuts to the state's child care reimbursement rate. News 8's government reporter Garrett Bergquist shows us how this will impact one center and the people who use it.
About 90 children fill the halls here at Hooligans Learning Academy. If the planned Child Care Development Fund rate cut goes into effect, some of those children will have to go elsewhere.
Can everyone make the letter I?
Macy Dunn says these small lessons are a big help later on.
So when they leave here, they're prepared to go to the public school systems. Most of our kids that leave here, they know all or most of their alphabet. They know how to write. They know how to recognize their alphabet.
Teachers here say about 90% of these kids are here because of Child Care Development Fund vouchers. One of them is Dunn's own daughter.
If I don't have CCDF, then I don't know what I would do, because then I wouldn't be able to make my house payment. I wouldn't be able to make my car payment. So I would be either a stay-at-home mom and find odd and end jobs, or I could bring her here and help me, because if I go and not have CCDF, then I'm paying $400 a week.
The Family and Social Services Administration is cutting its voucher reimbursement rates. Officials there say the program faces a $225 million funding gap through next year. They blame what they call unsustainable use of temporary COVID relief funds. They say, we made this decision to protect the children and families that depend on CCDF vouchers. There's only one pot of money. We could either protect providers or kids, and we chose kids. FSSA officials turned down my request for further comment.
We're not separate entities, it's all for one. So when you choose kids, you choose providers. When you choose providers, you choose kids. So hopefully we can get him to understand that and see that when you make budget cuts to CCDF, that's only going to make your budget for other programs go up.
Individual reimbursement rates vary based on income, county, and other variables. Beginning October 5th, Michael says her reimbursements will drop from $160 per child per week to $57.
I'm honestly scared to even think about. Enrollment is already so low with the wait list that they implemented that I really don't want to have to think about if children are going to have to pull.
Both Michael and United Way officials tell me they've heard from some providers who might not be able to stay open. United Way suggests working with your provider on options such as a sliding scale plan. But Dunn says she's out of options.
This is my first and only job I've ever had. If the rates cut down, then I lose my paycheck. And if I lose my paycheck, then I'm going to have to go find another job. And if I have to find another job, I know I won't be able to make ends meet.
And as with anything budget related, it is unlikely state lawmakers will make any changes before the next budget session. That's not until January of 2027. In Anderson, I'm Garrett Bergquist for Wish TV and WishTV.com.